That should do it. Should be live.
Are we up?
I think so. I'm going to go over and check.
Hi, everybody. This is Dr. Kieran Cody from Bucks County Orthopedics doing our Facebook Live. We've had a real nice series here of the different physicians coming in and connecting with our patients in this time with the COVID pandemic when it's so difficult for us to connect. This gives us a chance to connect and answer your questions. So to introduce myself, I've been here in Doylestown for 23 years as an orthopedic physician, but I'm actually not born, but I was raised in Bucks County, went through the Central Bucks School District, did most of my medical training in Philadelphia and Chicago. I did a fellowship at Stanford University in sports medicine, and that brought me back to Doylestown and couldn't be happier. We've raised our 4 boys here. So this has been a very difficult time for everybody. It's been difficult for people with medical problems. We have not been in the office, but we have been very busy. We've been doing telehealth visits, which have been very successful. I've been involved with the Doylestown Hospital, and there's been tremendous community support for the hospital. There's been donations of food, there's been donations of supplies and monetary donations. So the community has really come together at this time. And it's been really, truly a pleasure to watch. It's been inspiring. I have some good news today. Governor Wolf over the last week has announced that he's increasing the availability of medical services, including elective surgery. We will be increasing our hours in the office. We will be adding expanded hours, in-person visits. We are continuing with our telehealth visits. They've been very successful. And ultimately, people still want to continue with social distancing for safety. To enhance safety in our office, where we will continue to wear face masks. That's all the staff, all the providers, and the patients are asked to bring their own face masks. We will have enhanced cleaning in between each visit. We're going to spread out our office visits. We're asking patients to do more of their waiting in their car and not in the waiting room. The goal is to have people walk in the door and right back into an exam room. We'll have fewer patients in the office at any one time by being more spread out. And all of this will start next week. So if you have a medical problem, an orthopedic problem that you've been waiting to discuss with one of our doctors, please give us a call. The schedules are open and we can start filling it. So we look forward to having that opportunity to care for you in person as well as the telehealth visits. So my talk today is about shoulders. I have some excellent shoulder questions. The biggest problem people have been having is not having the availability of getting things fixed that they wanted to have fixed. So I'm just going to start right off with my first question from Jed. And the question was, I need to put off my rotator cuff surgery. What can I do about the pain? So I've been hearing that question all the time. Unfortunately, it's so difficult when we can't have people come in. So to take care of pain from a non-surgical point of view, which is the way you want to start with every problem anyway, we always start with the basics. The basics are going to be things like over-the-counter pain medication. That would be Tylenol and anti-inflammatory medicine like ibuprofen or Aleve. It is safe to combine those 2 medicines if you needed a little more than just one alone. There are different classes of medicines, so Tylenol and an anti-inflammatory. If we can come to the office, injections of cortisone can be very helpful to avoid surgery. Although injections sometimes will make it so you have to put off surgery because you don't want to have surgery within 3 months of a cortisone shot. Other non-surgical techniques are going to be ice, heat, and physical therapy. Now, physical therapy is taking place now Again, sort of like our office, the visits are very spread out. We're trying to minimize the intensity of physical therapy with going there, but you can get in to see physical therapists. There's also a website that I frequently refer patients to. It's by the American Academy of Orthopedic Surgeons, and it's called orthoinfo.org. So orthoinfo.org. And they have a tremendous wealth of information, including basic exercises, just to get started. So Jed, I hope that helps you out. I have a question from Karen V. She says, I am a dental hygienist, and I have pain from my shoulder to my elbows and my traps. That's the muscle on the top of the shoulder. The traps are tight. I've been off of work for 5 weeks, but the pain hasn't gone away. And I agree, I would have expected the pain to improve. Karen says, I've tried chiropractic and acupuncture. What else should I do? Well, Karen, unfortunately, dental hygienists, dentists, barbers, hairdressers are certainly patients who I see a lot. It's that prolonged time in a position with your hands up in front of you. It is very hard on the shoulders, and it does cause a lot of pain. I would recommend your next step would likely be to consider physical therapy. I find that people who do the same maneuver over and over again tend to get very strong in one muscle set or one muscle group, but the surrounding muscle groups become weaker, and then the shoulder becomes imbalanced. And it's that imbalance that leads to shoulder pain. So physical therapy could be very beneficial for you. Additionally, those other things I talked about before, Tylenol with anti-inflammatory medications could be helpful. And sometimes we use injections in the office. I would also say that if it's been 5 weeks that you've been off of work and you still are having pain, I would think that at that point, I start to consider an MRI or an X-ray or further diagnostic workup. I'm wondering, why is it that this pain is continuing even with that much rest? So I think it would be a good idea to perhaps pursue an office visit, and we could actually start doing a workup at this point. That might be something you need. Maria writes that I fractured my shoulder in December. The fracture was in several pieces, but non-displaced. In February, I started physical therapy and I had 12 sessions, but I had to stop it because of the pandemic. I still have pain and limited range of motion. If I tore my rotator cuff, will exercise hurt it? Well, you ask a good question. We don't actually know at this point if you have a rotator cuff tear or not. We've been following your x-rays, or someone's been following your x-rays. But it sounds like your fracture healed, which is terrific. I will say that shoulders are very slow to heal. They just are. Shoulders are one of the slowest joints in the body to bounce back after an injury. So unfortunately, that is part of it. So your question about should you keep up your exercises, and I would say yes. The worst thing in the world would be to develop a frozen shoulder because you didn't stretch your shoulder. And I would also tell you that stretching is very unlikely to damage a rotator cuff. I think stretching would be something that you want to do, and it usually helps out the pain. If you do have weakness in your shoulder, that to me is a red flag that maybe the rotator cuff is involved. So if you have weakness, that's when I would start to be thinking about getting that MRI to look into it a little further. So as soon as we can get you into the office or wherever that it is that you're going to be going, let's get you in, get it checked out, and see what you need. But do keep up the stretching exercises for sure. Don't stop those. I have another question from Nancy P. Nancy P writes, my husband works at a computer all day and he has shoulder pain. It's keeping him awake at night. He's tried Tylenol and topical medicines. Topical is the ones that will be like a cream. And it hurts when he raises his arm or when he rotates it in a circle. He wants to golf and the governor just opened up those golf courses, so I'm sure he's chomping at the bit. What should he do? Well, the first step with any shoulder pain or inflammation would be to try those anti-inflammatory medicines, Tylenol and Tylenol. The rotator cuff exercises will very much help. I'm going to just demonstrate some very basic exercises, and I did give you that site, orthoinfo.org, where you can find pictures and diagrams of how to get started. So this would be something very simple that you could start at home before you have the opportunity to get to a doctor's office or get to a physical therapist. So exercises for the shoulder are usually done with a TheraBand. That's a stretchy rubber band. They come in different resistances, and they are available. I'm sure we can get them on Amazon. And the rotator cuff is what we're worried about. So the rotation exercises are the ones that are going to help the most. So this we call external rotation. So you could start with that, and you do it until you're a little bit sore. Don't overdo it. So maybe 10 reps or something, and then stop. And then you turn the other direction and you do internal rotation. Again, 10 of those. And finally, finishing off with extension, which is like a row, like you're rowing, to build up your upper back. Those exercises can be a great place to start. If you're doing those sort of things and the pain continues, then we need to look into the problem further. That's going to be an X-ray, a physical exam by an orthopedic surgeon, and possibly an MRI if we're suspicious of some other further damage. I have a question here from Jonathan. Jonathan writes, my shoulder hurts. Is it a rotator cuff tear? Great question. Most people who come in with shoulder pain, the first thing they think about is a rotator cuff tear. That's the most common. It's certainly the one people have heard of, and it's probably the most feared because it is a relatively big surgery to fix, and it is a slow recovery. But certainly not every shoulder pain is a rotator cuff tear. The most common kinds of pain that I see in my office are actually bursitis or impingement. Those are inflammatory conditions. They can be caused by trauma, or they could be caused by just sleeping on your shoulder wrong, and you often don't even know what caused it. The first line treatments, we've mentioned them before. It's going to be to reduce inflammation. That's going to be an anti-inflammatory medicine, sometimes a cortisone shot, and absolutely these therapy exercises are tremendously helpful. So the things that make me think rotator cuff more than bursitis are going to be people who have weakness. So if you have a lot of weakness, especially if it's new, then I'm more suspicious of a rotator cuff. If you only have pain but no weakness, you're more likely to have an inflammation. Gary H. writes, I had a cortisone shot in my shoulder last year. I would like another as I lift weights, and it's become an issue. So we definitely find that cortisone shots can be very helpful. I do like to combine cortisone shots with a good therapy program because you want to balance the muscles. Gary mentions that he likes to lift weights, which is very healthy, and that's great. Sometimes people who lift weights tend to do the same exercises over and over and don't have a well-balanced program, which can cause imbalance to the shoulder muscles and make shoulder pain worse. So even though people are very active and they lift weights or they have a physical job, the therapy is still helpful, not to build up the muscles that they're using every day, but rather to balance those muscles with the other ones around it. So cortisone shots definitely can decrease inflammation, and they absolutely have a role. Oh, another question that I frequently get asked about cortisone is how often can I get it? The rule of thumb is that we don't like to give more than 3 shots in a year. So you're trying to spread them out at about a 4-month interval. Gary said it was about a year, so I would have no difficulty or problems with giving another injection after a year. Of course, you're more than welcome to come in anytime and we can take a look at that. Donna L. Oh, here's an interesting question. Donna L writes, is it better to do a 30-minute shoulder exercises or 2 15-minute sessions? I would say you'd probably get similar benefit from both for rehab exercises, but it's a matter of convenience. Some people find it much more convenient to spread the exercises out throughout the day or throughout the week. For instance, if they have 5 exercises to do, they might just do 2 on one day, 2 the next, and keep rotating. Some people, it's hard for them to get started, and once they get started, they might as well do it all. So I really would answer that question based on convenience, but I don't think you're harming yourself in either case. It's just you want to get those exercises in. So Alana writes, can a PRP injection help my chronic rotator cuff tendinitis? And the answer is yes. We have seen really nice responses to PRP. Like anything in medicine, it doesn't work 100% of the time on everybody, but a lot of people do seem to get benefit from PRP. So what is PRP? PRP is platelet-rich plasma. So the procedure works that we actually draw your blood and we spin it in a centrifuge in the office, and we get the platelet layer. So a tube of blood starts out like this. The platelet layer is in the middle. We isolate the platelet layer and then re-inject the platelet layer into the area of concern. The platelets have most of your growth factors and healing factors concentrated. So it's your own body's chemistry concentrated and re-injected where you need it. It's particularly good and has been shown to help tendons repair and to some extent moderate arthritis. So it absolutely could be worth a try, Alana. And again, that's something that we do in the office fairly regularly. It is a scheduled procedure. It's a procedure, but it's done through the office. We would always do an evaluation first. We'd come in, we'd do an evaluation, we would talk about it, and then we would set up the procedure, and you would come back and we would do it. Another question. Olivia writes, I can't take NSAIDs. What are my options? So I mentioned a few times today that I recommend people take anti-inflammatory medication to reduce inflammation. Well, there are many people who can't take them either because of an allergy, or if you're on a blood thinner, then you shouldn't take anti-inflammatory medicine, or if you have GI upset or heart disease. So there are many people who still try to avoid these medications. And if you can't take them, what are your options? Well, I usually recommend, of course, Tylenol is a different class of medicine, so that would still be safe. It's not anti-inflammatory, but it does have pain effects. Other ways you can reduce inflammation could be things like ice. Ice is a very nice natural anti-inflammatory. There are anti-inflammatories, natural ones like curcumin. There's a product called Synergesic that we often recommend in the office. That's a natural-based anti-inflammatory. A lot of these are not as strong, but in many cases, they're safer for the patient to take long-term. Marie writes, my shoulder hurts when I move it. My doctor wants me to do PT. How can that possibly help the pain? I get that question all the time in the office. People say, well, if there's a tear, how will moving it help? Or if it hurts when I move it, why is that going to help me? Well, the answer is all about the balancing of the muscles and the regaining of range of motion. You definitely do not want to have a stiff shoulder. A frozen shoulder is a horrible problem, and you want to do everything you can to prevent a frozen shoulder. The next thing comes down to the muscle balance. We need to balance the muscles around the shoulder to help decrease the impingement. It's when the muscles are out of balance that people get the most shoulder pain. So even though your shoulder hurts, PT will help. And I will tell you that our physical therapists with fitness physical therapy, they're associated with our practice. They do a wonderful job. They're very kind people. They don't want to hurt you, and they'll take good care of you. Jill writes, I'm told I need a new shoulder. Which is better, a regular shoulder or a reverse? Well, I do a lot of shoulder replacements, and I also get this question a lot. There are two main kinds. One's regular, and the other one is a reverse. So a regular shoulder or anatomic, you have your humerus bone here, and there's a ball on top of it, and the socket is part of the shoulder blade. Well, in the reverse shoulder, those two are reversed. The ball is on the shoulder blade and the socket gets put onto the top of the humerus. It's really a technical difference for the procedure. Most people, after they have the surgery, do not feel any different one way or the other. And the real question is, which type of shoulder do you need? It's not a matter of which is better. The reverse shoulder is excellent for people who also have rotator cuff tears or bone deformities. The anatomic shoulder, if you have regular arthritis and your rotator cuff is in good shape, then we would do an anatomic shoulder replacement. If you had another problem like a rotator cuff tear or something else going on, the reverse might be the better choice for you. I would say it's probably slightly more people end up getting a reverse shoulder because more people tend to have rotator cuff problems also. So I tend to see more of those, but we do both of those all the time at Doylestown Hospital. And they're both great solutions to people with bad shoulder pain. Heather writes, if I get a new shoulder, how fast can I get back to my usual activities? Well, people ask me about return after surgery all the time. And for my usual cases are going to be rotator cuff repairs for the shoulder or shoulder replacements, or simply taking off bone spurs. So the quickest recovery is going to be taking off bone spurs. Most of those people are only in a sling for a week, maybe two. They're into physical therapy fairly quickly, and hopefully back to work in 4 to 6 weeks, depending on how physical their work is. If you have a sitting job, a desk job, you can obviously get back a lot quicker. If your job is physical and construction, you have to lift really heavy things, that's going to be slower. The shoulder replacements surprisingly heal faster than the rotator cuff tears. And that's because you're not repairing the rotator cuff. And you're removing the arthritis. So the problem parts of the shoulder are gone and you're putting in new parts. So the replacements actually get back in about a month or two and can get back to most normal activities probably by 3 months after surgery. Rotator cuff tears, on the other hand, they can be small, medium, and large, but a large rotator cuff tear can easily take up to 6 months to heal, especially if you have a very physical job. So hopefully, Heather, your job's not physical and you'd be able to get back to work quickly. And Jeff has a question about the types of exercise that you can do. I did demonstrate a few of the exercises already, but in general terms, when people go back to the gym, I usually tell them the better exercises are going to be your pulling exercises. So pulling tends to be better than pushing. So that'd be pulling down, pulling towards you, pulling in. Those tend to be much better for the shoulder because they work the upper back. Those are the exercises that help the shoulder positioning the most. The exercises that are the least beneficial to the shoulder are going to be the chest exercises, the bench press, the military press, or even push-ups. You can do all of them, but you want to have balance to your workout. You want to work all muscle groups so the shoulder stays well centered in the socket. That finishes the questions that I have for today. Again, I just want to remind everybody that we are going to be open for in-person visits in addition to telehealth visits. So please call if you have a problem, question, or concern. Our visits are spread out. We will ask you to wear a mask. We will be wearing a mask. We will have people minimize waiting in the waiting area, and we're going to do this in a very safe and controlled manner. If you need to have elective surgery done, those are starting to be scheduled. It's going to probably ramp up gradually, but we are starting to schedule elective surgery as well. So thank you very much for joining us here at Bucks County Orthopedic Specialists. If you need anything, just give us a call, 215-348-7000. Take care.